Hello guys, welcome to my YouTube channel. My name is Ify and I am with my friend
Antonia Ify Obalo.
Okay, I thought you wanted to put your title.
Yeah, I wanted to put it.
She's Dr.
Yeah, doctorate in nursing, Dr. Antonia Ify Obalo. Doctorate in nursing practice.
You merited it. Give it to yourself. Yeah, she's doctor, so that means she has doctor in nurse practitioner, that's DNP. Meanwhile, people like us just have FNP. So we are getting there. She had a master. I have a master's. She has a doctorate. So today, since I have somebody in the house, and both of us, we're going to be talking about iron deficiency anemia. I know there are so many kinds of anemia, but today we just wanted to concentrate on talking about iron deficiency anemia. So I'm going to start by saying that iron deficiency anemia is one of the prominent problems you see among black people. So anemia is one of the problems that goes with us in the black population. And when we say iron deficiency anemia, there could be so many reasons why the patient doesn't have enough iron to form this blood, because the iron produced like every 3 to 4 months, and then you replenish itself and come back, repetition of that cycle. So when we look at the hemoglobin of a normal person, and this number that I'm going to give might vary depending on if it's a male or female, but I won't go into the details on that. I'm just going to give the bracket. So the hemoglobin normal hemoglobin is supposed to be 12 to 18, and then we have the hematocrit that is supposed to be 36 to 54. So with that is normal. When it goes below that level, then we say that your iron is low. There are some points where it gets to, like, if it's around 6 or so, around 6 or lower, we want to infuse blood. But in certain level that it is, it may be corrected with just an iron pill. And then we're going to talk about the treatment. But before that, I'm going to give it over to Antonia to tell us some of the symptoms and some of the symptoms of we feel when we have iron deficiency anemia.
Thank you. So, iron deficiency, when it happens to someone, the person will be feeling headache. The headache will be not the ordinary headache, maybe out of stress or something like that. The person will be having serious headache, and it's not as a result of stress or any other obvious reasons. So when somebody starts having this type of headache, especially maybe somebody who is pregnant or somebody who is already having some more comorbidities, sort of sickness, and having this headache, then the person could be checked or be assessed or evaluated for iron deficiency. And then it also, how we can know again when the person is being tired, that is fatigue, could also be a symptom of it. When there is not enough iron in the bloodstream, the person will be always fatigue and tired, and weakness is there. Then palpitations. All these are signs to note. And when somebody is having iron deficiency, ask the person, are you having so much, are you frequently having headache, fatigue, we're having weakness, or having palpitations? These are symptoms. Okay?
Another symptoms, just to add to some more to what Dr. Antonia has said, there are some other symptoms that we can see. We can see things like pica, We can also see pica, for those, in a layman's language, is just eating stuff that, that are not usual. Some people eat things like sand, some people just eat ice, and you see it in a pregnant women also. They just start eating some stupid stuff, and this is as a result of iron deficiency sign of symptoms that shows you that this person might have iron deficiency anemia. And then you can see, and this is usually in the late stage, their nails become like a spoon-shaped nail, and then brittle, is easy to break, that kind of stuff. So these are some of the stuff that you will see in some of the symptoms that you might also see. So moving on to the next point, we would like to talk about the causes of this, what can cause iron deficiency anemia. So
some of the causes could be poor iron absorption. When iron is not properly absorbed in one system, it will lead to deficiency in iron, because it's not being absorbed into your system, the person's blood system. So it could lead to the deficiency. It could lead to anemia. And another one is gastritis, which is inflammation of the gastric system. This is one of when there's an inflammation in the gastric system, so it could cause anemia, because then the blood is not absorbing iron in any way, because the gastric system is inflamed. And another one is lactation. When excessive lactation also leads to anemia. Another one is heavy menstrual bleeding in women. When one starts having heavy menstrual bleeding excessively, it leads to anemia. And then again, above 65 years old, when one gets up to 65 years and above, one will start checking the iron in the blood, because it is a time or a period in one's life that one becomes deficient in iron, leading to anemia.
Good job, Ife. So at this point, we're going to go back to how do we prevent the iron deficiency anemia. One of the ways we're going to try to prevent iron deficiency anemia is getting adequate diet. So adequate diet, what are some of the diets that we have, some of the foods that have iron in it? We have things like green vegetable, we have red meat, we have beans, and we have so many formulas that can also help us with this iron thing. So, and there's so many of it if I start listing it. So, but just to mention a few. So for the infants, for an infant, we should also use something like iron fortified formulas for them, especially at that young age. Formulas and the steroid that help the patient, the infant, to build in their red blood cells. Then we have the for the breastfeeding mother, we recommend that the mother receive some iron supplements, and then for the breastfeeding infant, we recommend that the infant receive some iron supplement starting at age 4 months. So, and we also screen the mother for a pregnant mother to make sure that, especially when they're high risk patients. So with that, this is the way we can prevent this.
We can also prevent anemia by ensuring that there's adequate dairy intake, like milk that has protein and has calcium and vitamin A, and again, diet rich in foods containing protein and iron is also very important, as it will help us to prevent iron deficiency in the system, and then energy conservation and frequent rest periods is also another way to prevent it, and transfusion of packed red blood cells.
Okay, so that's good. That's very good. So pharmacologically, the medication that we can use to treat it will be giving the patient the iron tablets. Usually, it's over the counter, and when we give patients the iron tablet, we should educate them that their poop can be things like black, and then taris too. It doesn't mean that they are bleeding or anything, because I have seen some patients run to the emergency room because their poop changed black, and that they run to the emergency room. We also can give them something for constipation, because iron can cause constipation, and some people experience diarrhea. Very few people experience diarrhea, so we ask them things like that. If they feel constipated, to buy some over-the-counter medication and use for constipation, and because if it's diarrhea, they do the otherwise. So that is it. But like I said earlier, another way is for us to transfuse blood. But before we transfuse blood, their hemoglobin is going to be 6 or less. So that's when we start transfusing blood. All right. So this brings us to the end of this video, and I hope this will help somebody with iron deficiency anemia. And thank you, Dr. Ife, for coming in today. I appreciate you.
Thank you.